So I'm going to talk a little bit about facelifting. Facelifting has been around forever, and it's a great technique. And for women who are in their 40s, even 50s, 60s, this is a very powerful technique to reverse the aging process. So what is a facelift? Facelift is basically lifting up sagging tissues. That sagging tissue is fat, sometimes some muscle, sometimes some skin, and putting it where it used to be 20, 30 years ago. So how does a facelift perform? Well, facelift is performed through incisions. It's a surgical procedure usually done under general anesthesia. So facelifts are categorized in many ways. You might hear the term mini facelift or 72-hour facelift or weekend facelift. What I'll talk about first is the traditional facelift approach and what that is. So the traditional facelift is a surgical procedure done under general anesthesia. And with my patients, I generally do like to do this under general anesthesia, though the twilight option is definitely there. We keep you comfortable, we keep you asleep, we keep you painless throughout the entire procedure. There are incisions that go around the ears, there's incisions that are under your chin sometimes, and what we do is we lift up sagging tissues, we remove excess fat, and we remove excess skin. And the idea is to put these tissues and structures back to where they were 20 to 30 years ago. How is a mini facelift different than a traditional facelift? Well, it has to do with the length of the incisions that are used, the length of the procedure itself, and really the longevity of the result. A traditional facelift is going to give you a longer result than things that are coined as S-lifts or mini lifts or weekend facelift or 72-hour facelift. So some people are great candidates for the mini facelift, but some really do need the full procedure. And the way you sort that out is you see one of us. You come in for a consultation, and we will be very honest with you about what we think can happen with this, what your results might be, and what your expectations should be from the procedure. Good candidates for facelift surgery are, number one, healthy people, usually in their 40s, 50s, 60s, up to 70s year olds. And good candidates are people that are healthy, that don't have a lot of medical problems, that are fit to undergo a surgical procedure that might last 4 to 6 hours. Poor candidates are ones, again, that have multiple medical problems that might preclude them from having general anesthesia or from having an extensive surgical procedure. At Jefferson, we're very equipped to be able to handle this type of procedure, and we're very careful as far as handling you medically and looking into your background to make sure that it is the safest possible environment for you to have this surgical procedure done. As far as the surgery itself, my personal goal is to really make you look great and make you look natural. The last thing I want is for someone to come up to you and say, hey, you had a facelift. What the goal would be is to make people come up to you and say, you look great. Did you get your hair done? Did you get your hair dyed? You look 20 years younger and not know why. That's the goal, and that's really the best results that I see. And what I love to hear is that nobody really said anything about my facelift. What they say is, what did you do to look so good?